Good morning. I'm Marketa Garner Walters. I'm your secretary for the Department of Children and Family Services. And I just want to say, I want to start by echoing what I've heard all my other peers say. Thank you for the work that you have done with the governor and the division to stabilize our budget and to support this department, because we serve all the people of Louisiana, and your constituents are our clients, and so we want to do that work. And I also want to start by saying that the staff of the Department of Children and Family Services and the foster parents that have taken care of the foster children during this COVID response has been simply unbelievable and stellar. I will talk about our COVID response as I talk about the three kind of buckets of work, or the three segments of work that we have in our department. You are being handed a copy of the PowerPoint, and I'm not going to go through this slide by slide. I will hit high points. And we are also giving you some information that, for those of you that are new to this committee, you may never have seen this before. We're providing for you two documents that tell you how much SNAP money is in your district, how many people are on the SNAP program in your district, and how many retailers are in your district, and how much money flows through those retailers. And so we have this for you by district. So I hope that you find that helpful. The SNAP program is big. People often have a lot of questions about it, and so we try to give you as much information as possible. Our mission is really broken down by the three buckets of work that we do. We work to keep children safe. That's our child welfare work. We work to help families and individuals become self-sufficient. That's our family support work. And we provide safe refuge during disasters, and that's our emergency preparedness work. In child welfare, there are several slides. I'm not going to go through all of them in sake of time, but I want to call your attention to, on page 4, the top slide that shows the standard caseloads and what we look like and what we should have in the state of Louisiana. In our budget request before you, there is a request for 50 staff. Now, I know you're thinking she must be crazy if she thinks we're going to be adding people during the midst of a budget crisis. DCFS has been understaffed by a net 1,500 staff for the past 5 years. We lost 2,000 staff in the previous administration, and 500 of those took the work with them, so that left us a net loss of 1,500. 1,000 of that was in family support, 500 of that was in child welfare. We've made a lot of changes in family support that I'll talk about in a minute, but in child welfare, we are 500 people short. We are asking you to slowly help us build back. We know we probably won't ever get to all 500 of those, but we are desperately short with the human beings we need to do the work of taking care of children in child abuse investigations and in foster care and adoption. Those are jobs that must be done by people. They cannot be automated. They cannot be done by anybody but a human that can work a case and work with a client. And so you have data here. You can see our turnover. You talked earlier with Secretary LeBlanc about the turnover that he has and the vacancies that he has and the difficulty he has finding people to do the work for the price that we pay. You can stock shelves at Costco on any given day in this state and make more than you can if you are a master's level child welfare worker. I want you to hear me say that. You can make more money stocking products on shelves than you can with a master's degree working in child welfare. Our staff are woefully underpaid. The work is extremely dangerous and difficult, and it is not recognized in that way. And that is why we have the turnover that we have. And although we have stabilized the turnover in the 4 years that we've been here, we are nowhere near where we need to be, and that's simply because there are not enough human beings doing the work, and so the people doing the work are overburdened in a way they should not be. Our response during COVID has been really what I think is stellar. Our child welfare staff, that the work for us begins when we get a call into our crisis line telling us there's a suspicion of child abuse or neglect. So we take that call in, then we evaluate it. We have a system that we go through to evaluate it, and then we decide if we're going to send someone out to investigate that call. When we send a child abuse investigator out into a home on any given day previous to COVID, we don't know what they're walking into, and they go in with no mace, no gun, no badge. They go in with a cell phone, used to be a clipboard, now it's a cell phone, or a tablet. And they could be walking into a meth lab, they could be walking into somebody with a gun, they could be walking into they don't know what, because you don't know what's behind that door. With COVID-19, that ramped up hugely. So our staff had to get PPE so they could go into the home. We called people ahead of time. We did everything we could to protect our staff as much as we could during that response. We made a lot of internal policy and procedure changes to be able to do we did deeper levels of screening to try to make sure we knew what we were walking into. And we did a lot of different policy to help us with the response. But our staff remained on call 24 hours a day, 7 days a week. The reports of child abuse have dropped drastically during this COVID response. It's almost half of what the normal child abuse report is. And that is because children are not in school. They're not being seen by teachers, who are our primary source of reporters. They're not going to their doctor's offices for their regular checkups, who are a second source of reporters. And our third highest mandated reporter is law enforcement. And so because people are at home and they're not out on the street, and they're not being around the places they're normally around, the abuse is not being reported. We don't know what that means. We don't know that when this is lifted, if we will have an outbreak of all sorts of reports and that we'll have to respond to, or if things will stay stable. There is really no way for us to project that. The closest thing we can come is what happens during the holiday season when families are all together. The reports usually go down then, and then they spike again right after the kids go back to school. But that's a different kind of season because you have peace on earth and goodwill to all men at Christmas, and families are usually happy, and it's gift giving, and the world feels better, and there are lots of family around, and that's not what's happening right now. People are isolated and depressed, and so we don't know what that's going to look like when it's time for our kids to go back to school, and we see them. But during the height of the crisis, we took 125 kids in care. That was to physical or sexual abuse and neglect. We served 3,946 children in the month of April compared to 4,016 in the month of March. So not a radical difference. And we've tried really hard to just stay connected to our families. Our foster parents, I cannot say enough, and I know many of you know foster parents and have supported us in our foster care work. We did not have a single foster family call us and say, come get this child, I can't care for them. That is basically unheard of in our work, to isolate any 3-month period and say we didn't have a disruption. That never happens. The only time that happened is, unfortunately, we had 3 foster parents die, and then we had to remove the children in those homes. And in one of those homes, the daughter of the foster parents stood up and said, but give them to me. I'll become certified as a foster parent because they're my family. So I just cannot say loudly and often enough how very blessed we have been with the foster parents that have served this state. We've also had some really fun adoptions. We didn't want adoptions to go down, and Representative Edmonds, I know this is a particular passion of yours. We had Zoom adoptions. We have virtual adoptions. We had adoptions with giant teddy bears that you could stand by and Zoom out and all your relatives could come. Our judges got very creative, and they worked really hard to finalize 105 adoptions so far. That compares to about 169 that we would normally have done in this time frame. And that doesn't sound like we're down many, but for every one of those kids that didn't get their adoption finalized, that's one less day that they're in their forever home. So we take this really seriously and are working really hard with our judges to make that those adoptions move quickly. In helping families become self-sufficient, that's where our child support enforcement work, our SNAP work, and our TANF programs are. Our SNAP, I know you just talked to Secretary Dejoie and you know what happened with unemployment. Well, the same thing happened with SNAP applications, with food stamps. We had over, I think it's 214,000 food stamp applications in a very, very short time frame. That is not our normal. By any chance, you have a lot of slides here on SNAP that I am not going through. But on page 11, there were 213 SNAP applications between March 16th and May 28th. We didn't have the staff capacity to manage all that. So what we did was pull staff from child support enforcement that we could pull staff from other parts of the agency that we could pull, and put them and train them in how to do an application. We did get several federal waivers that helped us tremendously and allowed us to do this work. We got a waiver from the feds that allowed us to give everybody on SNAP up to the maximum. There's a range that you can get when you apply for SNAP depending on the household composition. The feds said, okay, everybody automatically goes to maximum. So we automatically could load that on their cards and didn't have to worry about any process. They waived the interviews, the face-to-face interviews that we have to do. So we were able to go faster because we weren't doing that. Every 6 months when you're on SNAP, you have to be redetermined. That's our bureaucratic language. You have to be redetermined that you're still eligible. The feds waived that 6-month eligibility if it fell during that time frame. That allowed us to pull all the staff that normally works redeterminations and put them on processing applications. It's a little bit different work, very similar but different. They also waived the quality assurance review that we have to do for this time frame. So we were able to pull that QA staff and put them also on the front line. We added the Department of Revenue loan to some staff. We got some contracted staff, and with all of that, we've been able to process. We're down now into about the 13,000, 12,000 range of applications, which is well within our normal work. We also started another program in conjunction with the Department of Education called Pandemic EBT. This program is designed to feed the children that would have been in school getting free and reduced lunch. So they would have had breakfast and lunch had they still been in school. So it's an automatic one-time payment to all of those children for $285. That's what the cost of lunch and breakfast would have been per child for that number of days that they would have been in school. That program was really complicated. We are kind of the bank. SNAP money is the money that was paying that, but it was the education department's children. And so we had to do a partnership, and we had to bring in our partners at OTS, our technology services, to create a way for us to share that information, because right now we can share some data, but not all of that data that we needed to be able to produce these cards. We have extended that deadline. The original deadline was June 8th. We've extended it to June 15. There are about 600,000 children that would be eligible to receive this, and this morning we had reached 407,000 of them that we have reached so far. So out of the about 600,000, we're at around 400,000. So we still have a way to go. We want to get to every single one of those families. We know that they don't all speak English as their first language, and although we have all of our information in Spanish on the website, we have dedicated Saturday mornings as our call center place for people that either don't have internet access. They can call in, and we will take their application over the phone and put it into the system. And if they have a language issue, we have all of our stuff in Vietnamese and Spanish, but we want every single child that is eligible to receive this to get it. We also, as most of you know, do have a strong role in emergency preparedness, and this disaster is different from any disaster that we've had before. You've heard that over and over and over. We have, at our height, we've had about 109 of our staff that have been in emergency response functions right now. On any given day, probably 65 people have worked at all of the sites across the state where we are sheltering people that have been tested positive and have had to go to a facility, a place to be sheltered, and we've done that at state parks, and many of you have seen them or know about them. We worked with the Lieutenant Governor to pick a state park in the south, the middle, and the north part of our state, and we've had different people that have come there. Some of them have been homeless. Some of them have been people that worked in the crawfish industry, that worked at a plant where there was an outbreak. Some of them have been National Guard soldiers that have been on duty and become sick and had to have a place to retreat. Some of them have been people that either lived with somebody that might be elderly or having an underlying condition and they didn't want to go back into that home, or that person was sick, and an elderly person that didn't want to go into a home. And so it's been a variety of people that we have sheltered, and we are very pleased with that. On the very last slide, you see that we serve 1 in 5 Louisianians. That's on any given day. Right now, during the pandemic, that's closer to 1 in 3. It might be 1 in 2.5. If we could really do the math with all the people with the pandemic EBT, with the sheltering work that we have done. Members, I know that asking for positions right now sounds crazy. I know that. It is my job to tell you what the Department of Children and Family Services needs to do our work well. It is your job to appropriate those funds. I am begging you to look seriously if there is any way to find the $2.2 million that it needs to give us this staff in child welfare that we need. Prior to the COVID work, we really felt like this was going to be an easy ask. There was going to be money. We were going to get the staff we need, and our staff was really excited and thinking that help was on the way. And then all of our worlds turned upside down. I know that you have a really tough job to try to figure out how to allocate the money. I get that. I am not Pollyanna sitting here thinking that the world is all sunshine and rainbows. I know what my team needs to adequately deal with children that are in foster care and that are being abused and neglected. I need more people to work with these families. We are doing more and more prevention work, trying to stabilize families and keep them at home and keep them with their family and not make them ever go through the trauma that is foster care, because it's a traumatic system. It rips you away from everybody that you know and love, even if those people are hurting you. It's a trauma to take a child into care. It takes more time and more talent and more energy to deal with those families up front in their own home than it does to take them out and to put them in foster care. We are not taking the easy road. We are taking the hard road because it's better for our kids and their families if we can keep them together. I know it's a big ask, but I will continue as long as I have breath to say, we need these positions. This is not frivolous, and it is not done lightly. And I'm really asking you to consider to find a way to fund them.